everyone, what's up? It's Rui here, and today I'll be going over the iPhone Health app and Apple's path to dominating the healthcare space. Yes, dominating healthcare. Just to give you some context for this video, up until recently, I honestly had no idea that Apple was such a big player in healthcare, but they actually have been making big moves within the healthcare industry for years now. In a report by Morgan Stanley in 2019, analysts estimated that Apple's healthcare revenue would be anywhere from $15 billion to $313 billion by 2027. I mean, this is no small number, and they're able to dominate the healthcare space because 1, Apple is great at getting your health data. 2, Apple is great at getting you to love and use Apple products. And 3, Apple is great at getting you to not leave Apple. So first, how is Apple getting your healthcare data? Well, the first and most obvious way they're able to do this is just through the information that you manually enter into the iPhone Health app. So the iPhone Health app is just this pre-installed health app in every iPhone, and it's meant to be a composite of all your healthcare data that then shows you different insights and trends into your health activity. I really like the look and the feel of the iPhone Health app because it's really simple, it's easy to use, and it's customizable to whatever health information you care about the most through the favorites and highlights feature. In my personal settings, I've just chosen the headphone audio levels, sleep analysis, and sodium consumption as my favorites. But as you can see at the sleep analysis and sodium consumed areas, there's no data available for the app to analyze right now unless I manually enter it in. And this holds true for other areas in the app as well, where there's just not a lot of data available for it to analyze. This is a problem for Apple because a lot of people don't manually enter in their data. First, because it's difficult to know this kind of information yourself. For example, I don't know how many milligrams of sodium I consume every day, but also it's just a big hassle to have to enter it in every day, even if you do know it. So while this health app does seem really cool because it has a great aesthetic and it has these pretty graphs and trends, in reality, it just kind of sits in my phone because there's not a lot of data connected to it right now. But this is no problem for Apple because Apple knows how to get your health information. And it does this through passive data collection, getting the health information from your health providers, and also from other existing health apps that you use or apps that you may use in the future. In terms of passive data, with the Apple hardware just improving every year and the sensors getting better and better, your iPhone can collect data like the number of steps that you take every day, but in the future, it may take data like changes in your blood volume based off of how you interact with the screen of your iPhone on how much pressure you're applying to the screen and where you're touching. Apple also collects passive data like heart rate and sleep schedule through the Apple Watch series, and it's exploring ways to use AirPods to capture biometric data like heart rate, internal temperature, and oxygen consumption. Next, Apple is getting your data through healthcare providers. So far, Apple has teamed up with over 470 healthcare providers in the US, from hospitals, private practices, dentists, so that you can view your health records within these institutions all in your iPhone Health app. And lastly, Apple is getting your healthcare data from health apps that you're currently using or will use in the future through making it really easy for you to sync all the data from those apps into the iPhone Health app. And it has done this through creating this API or application programming interface called Healthhtech, which is basically the software framework that other app developers that are creating health apps can use, making it easy for the data in their health app to feed into the iPhone Health app. And the reason why other app developers would use Healthhtech is because it does really benefit them to gain access to Apple's user base and data that's relevant to their app. This will just make their app more accessible and give them more exposure through Apple's platform. Some examples of apps that are connected to the iPhone are MyFitnessPal, Calm, Sleep Cycle, the Adidas running app, and hundreds more. So this is a really smart move on Apple's part because Apple has essentially just made current and future competitor health apps to not be their threat, but additional sources of data that can just funnel into their overall data storage, which can then ultimately make the iPhone Health app this centralized source for all health data. Okay, now let's get into the second reason for how Apple can dominate healthcare. Well, Apple is great at getting you to love and use Apple products. Apple has a great brand and image, and they're known for creating products with a great design and customer experience. And every year they just roll out new features and versions of their products, which creates a lot of hype for the company as well. If you look at Apple's Net Promoter Score, which is a score from -100 to 100 that measures consumers' willingness to recommend a company's company's product, Apple scores a 60, while other existing health players like health insurers score much lower. Also, by partnering with other healthcare providers and creating software frameworks like HealthKit, this just brings more and more people into their health platform and ecosystem. On top of HealthKit, Apple has developed these two other software frameworks called ResearchKit, which makes it easier for researchers to conduct studies, and CareKit, making it easier for patients to connect with providers. Just to give you a little glimpse of how Apple can just leverage their existing large and loyal customer base in healthcare and research. So traditionally, to get 10,000 people enrolled in a study, it'll take around a year and 50 medical centers. But the Apple Heart Study was able to recruit over 400,000 participants using the iPhone in the span of 8 months within all 50 states. This is huge research potential for Apple, and with over 1 billion active Apple devices worldwide, this also makes it easy for medical device companies to create devices like an ultrasound, EKG, or otoscope that can connect directly to the iPhone. And the third and last reason for how Apple can dominate the healthcare space. Apple is great at getting you to not leave Apple. One thing Apple is great at doing is just creating this ecosystem where all their products just seamlessly tie together. You have your Macs, your iPhones, your AirPods, your Apple Watches, and everything just seems to be connected to each other in a really complementary way. This just hooks consumers to want to buy the next new Apple gadget. And since all of these products are connected to this unique ecosystem that Apple has created, this makes it really difficult for consumers to leave Apple or to go to other existing brands. Apple also has a lot of cash from non-healthcare related revenue streams, so this just gives them a lot of opportunity to just try and experiment different things without having to worry too much about the costs. They can also just use this money to acquire other competing healthcare companies. On top of that, as they develop more partnerships with healthcare providers and have more apps and medical devices connected into their healthcare platform, this just lays the foundation for Apple to one day become this truly universal, centralized platform for health data and digital health activities. So overall, Apple has this huge potential to dominate the healthcare space, so much so that in the future, when you think of healthcare, you may be thinking of Apple. But of course, with every big transition, a lot of people have concerns with Apple's big moves in healthcare. The first concern is just the potential harmful effects of having people being dependent on devices over doctors. Second, there are privacy concerns with a big tech conglomerate like Apple handling your data, especially because your health data is really sensitive and private information. You wouldn't want it to get into the hands of the wrong people or to be sold to other entities in any way. The last concern is whether or not we should leave healthcare in the hands of a for-profit company like Apple. Many people view healthcare as a public good that should be under the purview of the government. So there may be a lot of pushback from people if we leave something so critical to human life in the hands of a big tech company. These are just some things to think about, especially as healthcare becomes more digitized in the coming years. So thank you all very much for watching this video. Like this video if you liked it, and subscribe to my channel. And let me know your thoughts on Apple's big moves in healthcare. So stay safe, happy, and hope you have a beautiful day.